Good afternoon, everyone. I'm calling to order the House Committee on Consumer Protection and Commerce. Today is Thursday, April 20th, 2023. It is 2 p.m. We're in conference room 430. For those who are on Zoom, please keep yourselves muted and your video turned off until it is your turn to testify. If you are having technical issues, you can use the chat function to contact our staff. Okay, first on the agenda today, we have SCR 112 requesting the Hawaii State Center for Nursing to convene a working group to study the feasibility and impact of the state adopting the Nurse Licensure Compact. First to testify on this measure, we have Chelsea Fukunaga from the Board of Nursing with comments.
Good afternoon, Vice Chair, members of the committee. My name is Chelsea Fukunaga on behalf of the Board of Nursing. The Board of Nursing will stand on its written testimony, offering comments. Thank you.
Thank you. Next, we have Jace Mikulanik from the Queens Health System in support.
Aloha, Chair, Vice Chair, members of the committee. My name is Darren Dunbar. I'm the Senior Director of Nursing and Administration and Operations for the Queens Medical Center. We stand on our written testimony in support of this, and I'd like to highlight a couple points in our testimony. In my position, I'm responsible for the distribution of nursing and clinical resources to ensure safe and excellent patient care at Queens. Staffing our hospitals is a dynamic process impacted both by the volume of patients as well as the acuity of their condition, among other factors. During and after the pandemic, we've experienced peak patient volumes in each of our hospitals. These increased volumes, as well as heightened acuity, have increased our need for additional nurses and other clinicians. During the COVID surge in early 2022, Queens employed in excess of 400 contract nurses and other travel clinicians to provide quality care to our ohana. At that time, the emergency proclamation afforded nurses licensed in other states to work in Hawaii while their Hawaii license was being processed. The ability to rapidly onboard additional staff during that critical time of need was invaluable. Another challenge impacting healthcare resources across the country is the aging nursing workforce. Nurses from the baby boomer generation are now at or nearing retiring age. Recently, an article warned healthcare leaders that over 800,000 nurses will exit the profession by 2027. This narrowing pool of nurses adds to the challenge of ensuring enough caregivers in the coming years. Because of these and other issues impacting the healthcare workforce in Hawaii, we are hopeful for your endorsement of this resolution to convene a work group assessing the feasibility and impact of Hawaii entering the Nurse Licensure Compact. Mahalo for the opportunity to testify.
Thank you. Next, we have Laura Reichardt, Director for the Hawaii State Center of Nursing, with comments.
Good afternoon. Thank you so much for hearing this resolution. My name is Laura Reichardt, Director of the Hawaii State Center for Nursing. We stand on our written comments and emphasize that due to the scope of work and also the number of participants that would be on the task force, I feel like it would be difficult to fully complete that report by December. So instead of not doing a full job, due to those constraints, what I'm asking for is an extended time frame with the proposal to do an interim report for December 2024 and trying to get as much work done because of the sensitivity and urgency of the matter, and then continuing that work in the following year. If you would consider that, that'd be greatly appreciated.
Thank you. Next, we have Don Kurisu from HMSA in support. Thank you. Are there any other persons here to testify on this measure? Please go ahead.
Aloha, Chair, Vice Chair, and the CPN Committee. Angela Melody Young testifying on behalf of CARES in strong support. So the purpose of this resolution is to conduct a study to identify and assess the Nurse Licensure Compact's potential impacts relating to the state's nursing workforce, physical obligations of the state, including any fees or other costs, disciplinary actions taken against a nurse with a multi-state licensure privilege, healthcare workforce research and planning efforts, and any other matters that the working group deems applicable to the evaluation of the state's adoption of the Nurse Licensure Compact. And the NLC allows a nurse to have one multi-state license with ability to practice in the home state and other states. Various jurisdictions have enacted the NLC legislation. So anything we can do to support the medical sector, including addressing the nursing workforce, is very necessary. The state's home lists are no longer responding to HPD or law enforcement. The city's administration has implemented CORE, Crisis Outreach Response Engagement, a team of mental health professionals, trauma-informed care professionals, and social work professionals. The homeless do respond to medical care and nurses because what they need is not discipline. They're calling 911 because they're bored. They got high, they are experiencing crisis, they need attention. So I, as a public safety coordinator, am trying to explain the value of getting more nurses because of the impact from my personal experience from my line of work in my capacity as a safety coordinator. So, anything we can do to provide more for the nurses so that we can provide for our state's homeless concern is very necessary. Thank you.
Thank you. Any other person here to testify on this measure? Okay, seeing none, we'll be moving on to SCR 6, SD1, HD1. Oh, I'm sorry. Any questions, members?
Yeah, I have a question.
Please go ahead, Representative Onishi.
Laura, if you could please come on.
Yes.
Hi, thanks
Thank
for
you.
being here. This is a huge issue, right? I mean, our medical professionals. It's interesting that the issues that are being asked to look at doesn't have anything about our education system and our ability to provide for our own nurses.
Yes. And I really appreciate that question, and that is absolutely something that would contribute to the nursing workforce. As it relates to the Nurse License Compact, the Nurse License Compact is for people who have already completed their license. It's essentially license portability. Think about it like a driver's license. Our laws here would allow us, and me having a driver's license here would allow me to drive in another state or jurisdiction immediately, not have to go through their system. So it's kind of after the point of education. There is a lot of work happening in our state, including an initiative that is part of the governor's budget request, called the UH Health Workforce Initiative that's in HB 300, the state budget bill. And so there are efforts through that to increase the volume of education for nursing as well as other healthcare professionals within the UH system, and that would contribute to expanding our own local residents who are nurses or can become nurses. The Nurse License Compact is portability, so it would, in essence, allow for nurses to move back and forth in other states. When they have the research that exists now, it shows that there's about 10% transferability between states. The caveats are that all of the states that have been studied have no ocean, so they're kind of inland bound, and so it's not a good replication, and it's in migration and out migration. So there's 10% change, whether that means 10% coming in or 10% going out, but they didn't clarify further. Both are needed, absolutely, and as the representative from Queens mentioned, it's necessary to bring people in, particularly for specialty areas or when there's temporary needs, like a nurse is going on maternity or there's a flu season and you're expecting increased volume. But there's also a need to grow our own workforce, and that would be another initiative separately. They kind of are two different initiatives that feed the same workforce.
So how does this differ from the traveling nurses program?
It's the vehicle for which travel nurses would be able to come. So SB 63 is an initiative that would expedite temporary permits for nurses. That's one way that license portability would happen. So they can come in, they have a license in another state, and DCCA would have this mechanism to recognize their presence in the state and give them the authority or permission to work. The Nurse License Compact is another vehicle to do that same thing. And then just for context, the emergency proclamations that are putting a waiver allowing nurses from out of state to practice without a license. So our current waiver is a third vehicle under emergency proclamation. So there's a couple different vehicles to do it. The Nurse License Compact is highly adopted. The challenge is that the most use is really in those interstate border, the interstate jurisdiction locations, so kind of like sister cities across states. And I think that study or this task force would help us understand what the unique impacts to Hawaii would be, given that we don't have a lot of other states that are like us to compare to.
Yeah, well, the testimony from the nurses board indicated that there were already issues that have been identified about the compact.
There
Like the
are.
flexibility, issues about disciplinary action within other states, the licensure,
Yes.
revocation.
There is jurisdiction. There are issues related to jurisdiction. There's issues related to disciplinary action. Those need to be further understood. And this task force would be assigned to starting that level of understanding and going beyond what was provided in testimony.
Okay, thanks, Chair.
Thank you, members. Any further questions? Okay, seeing none, we'll be moving on to SCR 6 SD1 HD1, requesting the Department of Human Services MedQuest Division in collaboration with the Department of Commerce and Consumer Affairs to expand the types of qualified providers allowed to provide lactation consultant services for the Medicaid population in the state. First to testify on this measure, we have Lee Ann Tashima, the Executive Officer from DCCA Professional and Vocational Licensing Division, with comments.
Thank you. Good afternoon. My name is Leanne Tashima, and I'm an executive officer with the Professional and Vocational Licensing Division. On behalf of the department, because we're representing several different healthcare providers licensed under the Professional and Vocational Licensing Division, we'll stand on our written testimony offering comments on this measure. If you have any questions, I can try to answer them. Thank you.
Thank you. Next, we have Don Kurisu from HMSA in support. Thank you. Members, we also have written testimony in support from the Academy of Lactation Policy and Practice, and an individual and one individual in opposition. Are there any other persons here to testify? Please go ahead.
Angela Melody Young, testifying on behalf of CARES in strong support. So I'd like to present some medical content, but I will also simplify so that I'm not just tricking you into like nodding your head and going along with everything that I'm saying. So the purpose of this resolution is to request DHS's Quest integration in collaboration with DCAA to expand the list of healthcare providers to provide lactation consultation. A lactation consultant is a certified health professional who specializes in milk issues. A certified health professional can help parents and babies with issues like milk supply. Two variables, fertility choices and economic considerations, are connected. So poor people have more children than rich people. In general, poor countries tend to have higher levels of fertility than rich countries. In particular, women tend to give birth to no fewer than 3 children in rich countries. And in rich countries, women tend to give birth to 1 or 2 children. Rich nations such as the US have experienced a remarkable decrease in their fertility rate as they become rich. This is also experienced on an individual level, as rich families tend to have fewer children than poor families. Families, to simplify, so Medicaid is for poor people. So it is good for the state to invest in lactation consultant services to provide for the impoverished families who are on Medicaid. Thank you.
Thank you. Any other persons here to testify on this measure? Okay, seeing none, members, are there any questions? Seeing none, we'll be moving on to SCR 42, requesting the Blood Bank of Hawaii to expedite the process of removing the deferral for individuals previously considered to be exposed to Creutzfeldt-Jacobs disease, thank you, and variant Creutzfeldt-Jacobs disease to assist with the urgent demand for blood in the state. First to testify, actually, we don't have any testimony on hand. Are there any persons here to testify? Please go ahead.
Angela Melody Young, testifying to provide comments. The state is experiencing a historic blood inventory shortage. The Blood Bank of Hawaii is the sole provider of blood to the 18 civilian hospitals in the state and one on Guam. The blood supply shortage constitutes a health crisis that poses a risk to those who may suffer medical emergencies and require blood transfusions. The disease CJD, Creutzfeldt-Jakob, is a rare, rapidly progressive degenerative brain disorder. In theory, CJD can be transmitted from an infected person to others, but only through an injection or consuming infected brain or nervous tissue. There's no evidence that sporadic CJD is spread through ordinary day-to-day contact with those affected or by airborne droplets, blood, or through fornication. There is evidence that CJD can be transmitted from donors to patients through blood transfusions. So before the state authorizes a resolution to let potentially those who are infected with CJD to give blood, it does implore for more medical diagnostics to be performed. The bottom line is people who have a disease or have symptoms of infections, it should be for consideration that maybe that's not appropriate for them to donate blood. Thank you for the opportunity to testify.
Thank you. Are there any other persons here to testify on this measure? Okay, seeing none, members, are there any questions? Seeing none, we'll be moving on to SCR 73, requesting the Department of Transportation to conduct an assessment report to evaluate the feasibility and practicality of implementing higher levels of commercial general liability insurance for the general aviation industry and helicopter operations at airports in the state. Members, we have written testimony in support from Congressman Ed Case's office, as well as Blue Hawaiian Helicopters in support. Are there any persons here to testify on this measure? Please go ahead.
Aloha, good afternoon. Quinn Koch, President for Blue Hawaiian Helicopters. Stand on my written testimony and here to answer if you guys have any questions.
Thank you. Any other persons here to testify on this measure? Please go ahead.
Angela Melody Young, testifying on behalf of CARES. In strong support, Commercial General Liability Insurance, or CGL insurance, helps protect businesses from claims that it caused bodily injuries or damage to another person's property. This coverage is also known as general liability insurance or business liability insurance, and that's a great asset to have. General liability insurance definitions can get confusing, but to simplify, it covers claims arising from injuries or damages, such as damage to someone's property, bodily injury, personal injury, like slander or gossip, and also advertising injury. So insurance AIG is a aerospace insurance solution for nearly every type of industry that uses aircraft from agriculture to airports, and it equips businesses with customized options that help minimize risk and maximize safety. If a loss does occur, our dedicated team of aviation adjusters and attorneys are located throughout the world, ready to respond whenever and wherever needed. Wherever you travel, AIG responds quickly, and it delivers creative and flexible solutions for the most complex coverage needs within the aerospace industry, for seamless integration of domestic and multinational solutions. Thank you.
Thank you. Any other persons here to testify? Seeing none, members, any questions? Seeing none, we'll be moving on to SCR 145 SD1, requesting the Department of Transportation to study the feasibility and advisability of eliminating the state's safety inspection requirements for motor vehicles. Members, we have written testimony in support from the Department of Transportation and 2 individuals, and a written testimony from the Grassroots Institute of Hawaii with comments. Are there any persons here to testify on this measure? Okay, seeing none, members will be taking a short recess for decision making. Good afternoon. I'm reconvening the House Committee on Consumer Protection and Commerce for decision making. First to vote on SCR 112. We'll be passing this measure as is. Members, are there any comments, discussion? Okay, seeing none, Representative Amato for the vote as is.
All right, so the recommendation is voting on SCR 112. Recommendation is to pass as is. Representative Nakashima is excused. Vice Chair votes aye. Let's see, we have Amato votes aye. Representative Bellotti excused. Representative Hashem. Aye. Representative Burdick excused. Representative Gates excused. Representative Lowen.
Aye.
Representative Onishi.
Aye.
Representative Tam.
Aye.
And Representative Pierik.
Aye.
Thank you, sir. Your measure is adopted.
Thank you. Moving on to SCR 6, SD1, HD1. My recommendation is that we pass this forward as is. Members, are there any discussions, concerns? Okay, thank you. Representative Amato for the vote on SCR 6, SD1, HD1 as is.
Voting on SCR 6, SD1, HD1, noting the excused absences of Representative Chair Nakashima, Representative Bellotti, Representative Hesse Burdick, Representative Gates. Any members voting no? Any members with reservations? Thank you, Chair. Your measure is adopted.
Thank you. Moving on, voting on SCR 42, my recommendation is that we pass this forward as is. Members, are there any questions or discussions? Seeing none, Representative Amato for the vote as is.
Voting on SCR 42, the recommendation is to pass as is, noting the excused absence of Chair Nakashima, Representative Bellotti, Representative Burdick, Representative Gates. Any members voting no? Any members with reservations? Thank you, Chair. Vice Chair, your recommendation is adopted.
Thank you. Moving on to SCR 73. My recommendation is that we move this measure forward as is. Members, are there any questions or discussion? Okay, seeing none, Representative Amato for the vote on SCR 73 as is.
Voting on SCR 73, the recommendation is to pass as is, noting the excused absences of Chair Nakashima, Representatives Bellotti, Hesse Burdick, Gates. Any members voting no? Any members with reservations? Thank you, Vice Chair. Your recommendation is adopted.
Thank you. Moving on to SCR 145 SD1. My recommendation is that we pass this measure forward as is, though I do like to note that the Department of Transportation did not come to testify, though I would like to ask them for further expansion on their written testimony. Members, are there any questions or discussion?
Chair.
Please go ahead.
I have concerns about the resolution and some of the context. I mean, could it be part of the reason why we don't have too many accidents is because we have these inspections and equipment, the vehicles need to be fixed in order for them to get the inspection certificate. So, it contributes to maybe the lower amount of accidents that we have. And getting rid of this might have the opposite effect of increasing the number of defective vehicles or vehicles with problems on the road, thereby creating more accidents. So, I do have concerns about us getting rid of this process. The other thing is we're looking at passing a bill to do conversion from the gas tax to a road usage fee. And the only way we can track the amount of miles driven is, or accurately track is through your odometer readings, which are taken during these annual inspections. So with that, I have to vote with reservations on this one.
Thank you. Members, any other discussion? Representative Tam.
I echo the same sentiments by the representative from Hilo.
My main concern with this bill, with this reso, is that we are also talking about cars that have been illegally souped up. And as we tackle noise pollution as an environmental issue, as a quality of life issue, as a health issues, I think that, those that are issuing vehicle inspections have a major role to play in ensuring that cars aren't illegally souped up to make loud noises in our neighborhoods. So I would like to see it go forward. I want to see what the study has to say, but I too will be voting with reservations.
Thank you. Any further discussion? Seeing none, Representative Amato for the vote on SCR 145 SD1 as is.
All right, we're voting on the final measure this afternoon, SCR 145 SD1. Recommendation is to pass as is, noting the excused absence of Chair Nakashima, Representative Bellotti, Representative Hussey Burdick, and Representative Gates, and also noting the with reservations of Representative Onishi and Tam. Any other members voting no? No. No for Representative Pyrick. Any other members with reservations? Seeing none. Thank you, Vice Chair. Your recommendation is adopted.
Thank you, members. This committee is adjourned.
Thank you, Vice Chair.